Hello, my name is Lydia Gowan. I'm an Arkansas State University Family Nurse Practitioner student. This is my assessment video for respiratory, cardiovascular, peripheral vascular, axillary, and breasts. I'll do my 360-degree scan of the room. My equipment is over there. And perform hand hygiene and put on appropriate PPE. Beginning with respiratory, we are inspecting our patient for any signs of respiratory distress. His respiration rate appears to be 18 breaths per minute with a regular rate in rhythm and depth. Looking anteriorly and posteriorly, looking at the neck and the supraclavicular muscles, there are no accessory muscle usage. Looking anteriorly and posteriorly at the lower intercostal spaces, there are no retractions noted. Measuring the anterior posterior diameter to the lateral diameter, the lateral is wider. Looking anteriorly and posteriorly for any asymmetry or abnormal movements. Respirations are equal. There are no signs of funnel, pigeon, barrel chest, or flail segments. Inspiration is longer than expiration. The patient does not appear to be in any acute distress. He has effortless breathing. We're going to move on to palpitation. If I can have you turn. We're going to palpate the posterior chest for any pain, lesions, bruising, tenderness, abrasions. None is noted. And if you'll turn for me, palpate the anterior chest for the same thing. Pain, lesions, bruising, tenderness, none noted. We're going to move on to percussion. If I can have you turn again. We're going to percuss the posterior chest. Patient will cross his arms. We're going to put our hand down firmly on the patient, have the distal interphalangeal joint pressed against the skin, striking it with the opposite hand, third finger, in a brisk motion, moving in a ladder pattern. Okay, all areas of percussion have a resonant tone. We are going to move on to auscultation. We're going to auscultate the posterior chest using the diaphragm of the stethoscope, moving in a ladder pattern. Patient will be taking deep breaths. Okay. And now we're going to auscultate the anterior chest. If I can have you turn for me. You're going to be moving in a ladder pattern, mid-clavicular, avoiding breast tissue, taking deep breaths. Okay. All areas of auscultation of the respiratory fields have vesicular breath sounds with no adventitious breath sounds such as wheezing, crackles, or rhonchi. We will now move on to the cardiovascular assessment. If I can get you to lay on the couch. The patient will be lying in a 30-degree angle using a light to assess carotid pulses and JVP. If you can turn your head for me. Okay, and now turn this way. Okay. JVPs have no distension noted bilaterally, and also bilaterally carotid pulsations are visualized. We will now palpate the carotid pulses one at a time. Okay. Carotid pulses are 2+ bilaterally with no thrills palpated. We will palpate the point of maximal impulse, fourth to fifth intercostal space, midclavicular line. It is palpated on the expected location with normal amplitude and duration. Now we're going to auscultate the carotids using the bell of the stethoscope. The patient will hold his breath while we do this. And on the other side. Okay. Carotids are auscultated with no bruise. We will now auscultate the heart sounds, the 5 heart sounds using first the diaphragm and then the bell. Aortic, pulmonic, Erb's point, mitral, tricuspid, and now the bell, aortic, pulmonic, Erb's point, mitral, tricuspid. Heart rate and rhythm is regular. S1 and S2 are visualized. No S3, no S4, no murmur, rubs or clicks or extra heart sounds are auscultated. We'll measure the JVPs. Okay, and now the other side. And JVP position is in normal limits. Now we will move on to the peripheral vascular assessment. I'm going to get you to sit on the side of the couch. Alright, starting with inspection, we're inspecting the lower extremities for size, symmetry, edema. Bilateral lower extremities are free from any edema visualized. They appear to be symmetric. Skin color of the lower extremities is appropriate for ethnicity bilaterally. There is no discoloration noted. Looking at the hair distribution of the lower extremities, the legs, foot, and toes bilaterally, it is even and in the expected locations. Can you raise your foot for me? Okay, and the other one. All right, looking at the feet and the soles, there are no discolorations, no rashes, bruising, lesions noted bilaterally. We're going to palpate now temperature of the lower extremities using the backs of my hands. Skin temperature of the legs is warm, dry, and even bilaterally. Skin temperature of the feet, warm, dry, and even bilaterally. We're going to palpate the pulses of the lower extremities. We have the femoral, popliteal, dorsalis pedis, and we have the posterior tibial. All pulses are 2+ and equal bilaterally. We will palpate the capillary refills of the toenails until they blanch. Bilateral lower extremity capillary refill is less than 2 seconds. We will palpate the inguinal lymph nodes. Inguinal lymph nodes are soft, mobile, non-tender, free from enlargement bilaterally. I'll have the patient stand. Assessing for varicosities, there are none present bilaterally. Okay, you can sit. So now we are going to move on to the axillary. I'll wash my hands before performing anything else. If you can raise your arms up. Okay, so inspecting the bilateral axillary regions, we are inspecting for any rash, discoloration, obvious nodules, hair distribution. Hair distribution is equal. There are no rashes, discolorations, no nodules seen. We're going to palpate the lymph nodes of the axillary regions. We have the central lymph nodes. We have the lateral, pectoral, to. We have the supraclavicular and infraclavicular. Okay. All lymph nodes are mobile, non-tender, not enlarged, bilaterally. We will now move on to the breast examination. This is a verbal examination not performed. For the female breast exam, you would inspect the patient in 4 different positions. You would have the patient sitting with the arms to the side. You'd have them raise their arms above the head, hands pressed to the hips, and then leaning forward. In all 4 positions, you're assessing the breast bilaterally for color, nodules. You're looking at the contour, looking at the nipples for inversion, direction, symmetry. You're looking for any discolorations. You'll palpate, having the patient raise the ipsilateral hand of the assessment above the head, palpating the entire breast with the 2nd, 3rd, and 4th pads moving in concentric circles in a vertical strip pattern, including the tail of Spence, covering the entire breast. During the palpitation exam, you are assessing consistency, tenderness, and feeling for any nodules. For the male breast exam, you would be inspecting for any enlargements, swelling, discoloration, any gynecomastia, any tenderness. For palpitation of the male breast exam, you'd palpate the areola and breast tissue to differentiate nodular enlargement from tissue enlargement. And that concludes my exam. Thank you.